Good morning, Lewis Brown. I am Mihiraa. Let's start the warm-up sessions. What do you find is the hardest part about being a nurse?
I think the hardest thing I've had to deal with is feeling helpless. While it's my job to provide as much care and comfort as medically possible, there are times when I just can't do more. Seeing someone in pain or feeling miserable and knowing there's nothing you can do to help is the most difficult thing I deal with. I am a nurse because I genuinely care about people and want to help, and when I can't, that's hard.
Are you comfortable working with other doctors and nurses?
I find I work well under a variety of conditions and circumstances, and I take pride in my flexibility. I enjoy working in a team because I often find that different viewpoints can help me find solutions to a problem I might not think of on my own. I also enjoy self-motivating and am equally comfortable working alone.
What is the importance of communication in nursing?
Communication in nursing is the exchange of information, thoughts, or feelings between nurses and patients, as well as among nurses and other healthcare professionals. Communication is important in nursing because it facilitates the delivery of quality care and builds trust and rapport. Communication also helps nurses to ensure patient safety by verifying information, reporting changes, and following protocols.
How will you make a positive impact on the nursing profession?
There are different ways to contribute to making a positive impact on the nursing profession. Creating feedback forms as forms helps us secure and promote our jobs and give us the motivation to work hard. Nurses deserve better working standards and benefits for their hard work. Therefore, listen carefully to what nurses have to say to light down the workload. Additionally, provides continuing education for all to make us stay updated to be the best always.
How do you deal with someone who isn't satisfied with your patient care?
When faced with a dissatisfied patient, I assess the issue, determine if it's something within my control to correct, address their concerns, answer their questions, and collaborate with colleagues for alternative solutions if necessary. My goal is to accommodate the patient without compromising their care.
You can now start your OET roleplay.
Thank you, Mihiraa. I just finished examining you. Well, how have you been managing since my last visit?
Nurse Lewis. I've been doing okay, but the oxygen mask has been a bit uncomfortable.
I'm sorry to hear that the oxygen mask has been uncomfortable for you, Mihiraa. I want you to be as comfortable as possible during your recovery. Based on my assessment today, I have some good news. Your lungs sound much clearer, and your oxygen saturation levels are excellent. It's clear that you're responding very well to the treatment. Given these positive changes, I believe we can make some changes in your oxygen therapy. The change is that it is now possible to switch from an oxygen mask to a nasal cannula. This should make your recovery process more pleasant and less cumbersome. How does that sound to you?
Oh, that sounds better. Can you tell me more about the nasal cannula?
Absolutely. I'm glad to hear that it sounds better to you, Mihiraa. The nasal cannula is a simple and effective device. It consists of a thin tube with two small prongs that fit gently into your nostrils. Unlike the oxygen mask, it's much less restrictive, allowing you to move around more freely. One of the main benefits of the nasal cannula is that it delivers oxygen effectively while being more comfortable for you. You'll find it easier to talk and eat without the bulkiness of the mask, which should make daily activities more pleasant. Mihiraa, it's designed to provide you with the necessary oxygen while ensuring you stay comfortable and can go about your day with less inconvenience. Does that sound good to you? Do you have any other questions or concerns about using the nasal cannula?
That does sound more comfortable. But I am a bit concerned that will it provide the same amount of oxygen?
Yes, I completely understand your concern, Mihiraa. Let me reassure you that the nasal cannula will deliver the same amount of oxygen as the mask does. It's designed to provide the same therapeutic benefits while giving you much more freedom of movement and comfort. You'll be able to breathe easier and move around without feeling restricted. Switching to the nasal cannula is a positive step in your recovery, and it's important to me that you feel comfortable and confident with this change. Do you have any other concerns or questions about switching to the nasal cannula? I'm here to help with anything you need.
While that sounds reassuring, I do have a bit of concern about getting used to it. Why can't we continue with the oxygen mask?
It's perfectly natural to feel that way about changing something that you're used to. I'm here to help you adjust. The oxygen mask has been helpful, but the nasal cannula is the next step in your recovery for several important reasons. First, your continued recovery is our top priority, and the nasal cannula will provide the same oxygen benefits while being much more convenient for you. Secondly, the nasal cannula reduces the risk of irritation and discomfort that can come from wearing a mask for extended periods. This can help your skin stay healthier and prevent any pressure sores or irritation. Additionally, using the nasal cannula will make it easier for you to talk, eat, and move around, which is crucial for your overall well-being and daily activities. It can also help with better compliance, as patients often find the nasal cannula more comfortable and less intrusive, making it easier to stick with the oxygen therapy. With all these benefits in mind, do you feel comfortable giving the nasal cannula a try? Your comfort and health are very important to me, so I want to ensure you're on board with this step. Would it be okay with you if we give the nasal cannula a try?
All right, I trust your judgment. Let's give it a try.
Great. I'll go ahead and make the switch.